Is it recording? Yeah, okay.
Action.
Knock, knock.
Hello.
Hi, Mr. White. I'm just going to close the door here. Wash my hands. Can you tell me your name and date of birth, please?
Keith White, 1985.
All right, matches your wristband and the MAR. I'm Riley. I'm going to be your nurse today. We're going to do a couple of things. First, how are you feeling?
I'm a little short of breath.
A little short of breath. All right, so we're going to go ahead and raise that head of your bed there. Okay, very good. All righty. And I'm just going to put the pulse ox on you, see where you're sitting at. All right, 88%. That's much too low. So we're going to put you on some oxygen, 2 liters here. The nasal cannula is just going to go into your nose, down this way. Put that into your nose, around the back of your ears, okay? And your ears feel good. All right, take some good breaths. Just going to listen to your lungs here. Okay. Very good. Okay, and then if you could just lean forward a little for me. Perfect. Okay, I don't hear any fluid overload or any wheezes, abnormal sounds, or anything like that. Are you having an easier time breathing now?
Oh, yeah.
All right. And that pulse ox is at 95%. That's great. Okay, so like I said, there's a few things I wanted to check. I did also want to check your IV. I do have the orders with me here. Okay, and your IV solution bag is the same as the doctor's orders, as well as the rate on your IV pump over there. Very good. Okay. I'm also going to follow that IV tubing from the bag all the way down. Make sure there's no kinks, no big giant air bubbles, anything like that abnormal. And then I'm going to look at your IV site. First, I'm going to go ahead and wash my hands, and I'm going to put on some gloves here. Okay, so I'm just looking for any edema. You have any pain in this area at all?
No.
Okay. There's no warmth, and there's no... I said edema, I said, okay, so everything looks normal at your IV site here. Okay, and then along with your IV, we want to make sure we don't overload you with fluid. So I listened to your lungs already, they sound great, nothing abnormal there. I'm also going to look at your feet over here, make sure your pulses are nice and strong and equal, and that there's no edema, again looking for fluid overload. Don't let that cat jump on you. You've got an abdominal wound here. Speaking of which, I'm going to check that out here. I'm just going to open that area, but still providing for privacy. Make sure I only show that area, okay? We did medicate for pain a few hours ago. How is that pain?
Fine.
Fine. On a scale of 1 to 10, with 1 being very little, 10 being worst pain ever. Where would you put that at right now?
1.
Oh, 1. Awesome. Okie dokie. So I'm just going to go ahead and wash my hands again. We're going to put some gloves on. And I did come in earlier when we did the pain. Get that cash. That's not part of the video. Okay, so I put my gloves on. Don't touch it. I washed my hands and put my gloves on. Okay, so I did come in earlier and set up all my equipment here when we assessed your pain and managed that. So I've got my tape, I've got my gauze, I've got my ABD pads. I'm just going to go ahead and open those up over here. Make sure I've got everything situated. Okay. So I'm looking at your abdomen. It's nice and flat. I don't see any abnormalities there. I'm just going to touch. You let me know if there's any pain.
Nothing.
No, just maybe a little tender over around the site. Okay. Okay, and I noticed you don't have a JP drain. I would also be assessing that, emptying that JP drain. If you ever had one, you want to open that valve up. Be careful because of the suctioning. Sometimes it does kind of splatter a little bit if there's a lot in there. We're going to dump that out into a cup. Put the cup to the side. Alcohol swab that opening there. We want to make sure that we keep that all clean. When you close it up, you want to squeeze that JP drain so that when it is closed, it keeps that suction so it can pull out all of the fluids it needs to drain. Okay? All right, so we're just going to go ahead and start by taking this old dressing off here. You let me know if I start to get anywhere tender. I can always stop.
Okay.
Okay? All right, here. Okay, very good. Nothing on that ABD pad there. And you do have another gauze. There is some serosanguinous drainage on that dressing that I will document once I'm finished here. And your sutures look very nice. 1, 2, 3, 4, 5, 6 with approximated edges and no signs of infection, no warmth, no tenderness. Okay, and no edema. Very good. All right, so I'm just going to take off those old gloves and give my hands a wash. And we're going to put new gloves on. Since that old dressing was dirty, now we want to only touch it with clean hands, clean gloves. My hands are wet from the washing it, so sometimes it's a little difficult. That's okay. Very good. The order does not say to wash anything, so I'm just going to replace the same dressings that we had. So again, we're going to start with the sponge. If you did have a drain, there would be a drain sponge underneath that one as well, just to protect your skin from the tubing. And then the ABD pad goes on just in case there is any extra drainage that we want to contain. Okay. Give that a couple pieces of tape here. You're still doing okay?
Mm-hmm.
All right. Okay. All right. Very good. Of course, with everything I'm doing, I do document everything in your chart, which I will do later. Okay. Now's the fun part, okay? So we're going to go ahead and put in a nasogastric tube. I'm just going to wash my hands here. Now, I know when I looked in your chart, you didn't have any allergies to adhesives. You have any allergies at all?
No.
No, okay. Can you give me your name and date of birth one more time?
Keith White, 1985.
Awesome, okay. So this nasogastric tube is a tube that goes from your nose to your stomach. It is a little uncomfortable to put in, but I am going to talk you through it. And if there is any discomfort, you can always tell me to stop, okay?
Okay.
Okay. So I have some of my supplies here. I'm going to throw away some of this stuff. I'm going to give you this cup of water. At some point in the early stages of putting the nasogastric tube in, you're going to start to gag. Okay, that's normal. I'm going to tell you to put your chin to your chest and take some sips of that water. We're just going to keep going. If you do feel any discomfort, you tell me to stop, okay?
Okay.
All right. I checked the suction. The suction is working. The order is to put it on intermittent suction, so we're going to do that, okay? Alrighty, so we got a couple of things here. So this is the nasogastric tube. I'm going to take it out. If this fell in real life, obviously I would get a new one. But for the purposes of the video, I'm just going to keep this one. Okay, so this is the nasogastric tube. I'm going to go ahead and measure it. I did wash my hands before touching all of this stuff, so I'm touching it with clean hands. Because the gastrointestinal system is not sterile, this is just a clean procedure, so we don't need to use any sterile procedure here. Okay, so this is the tube. I need to measure how far down it needs to go. Okay, so that measurement goes from the tip of this tubing here, from the tip of your nose, I'll show this for the video, to the tip of the earlobe, and then down to the xiphoid process. So since I did look in the pen light here, make sure we don't have anything abnormal in there. I think I'm going to go ahead and use your right side. So I'm just going to measure this from the tip of your nose to the tip of your earlobe, and then down to your xiphoid process here. All right. We're going to go ahead and go down to 58 there. I'm just going to take a small piece of tape to mark, remind myself where I'm going here. Okay. Alrighty, and then I'm going to attach the syringe here to the bottom. Okay. Put some lubrication on there. Wash my hands and put on some clean gloves. Alrighty. Okie dokie, here we go. Very good job. Oh, good gag. Okay,
what?
Put your chin down to your chest there. Very good. Okay, take some sips of this water here. Very good. Awesome job. Keep going. Very good. Okay. Awesome. You can stop swallowing there. I do want to take a look. For the purposes of this video, can you hold that for me? Right there? Like back here so I can look. Okay, so I'm just going to go ahead and look at the back of your throat. Say, ah. Very good. No kinks, and it is back there. Okie dokie. Of course, I would be holding on to this because we don't want it to come out. At this point, I'm going to aspirate for some gastric fluid. Make sure that we're in the right spot. Very good. 30 cc's of some nice green fluid there. I'm going to leave that in there because I do want to check the pH, make sure we're in the right spot. We're also going to do a chest x-ray to make sure that we are in the stomach there. So I'm going to go ahead and tape this here. Being very good patient. I know this is difficult. Okay, very good. And then I'm just going to attach this one up here to, attach it to your gown. I'm going to clamp this off, pull my syringe out. Boy, I put it in there, huh? Pull my syringe out and attach it to the suction. Turn the suction on. Okay. How are you feeling?
Fine.
Very good. Okay, so I'm going to take my gloves off, wash my hands. Okay, so it's been a while, and I noticed that there's not a lot of gastric fluids in your suction canister, so I want to give that a good flush as ordered per the doctor. He ordered 30 cc's of some distilled water to kind of flush out that tubing, okay? So I'm going to wash my hands and don gloves. Now for the purposes of this video, I do only have one glove left, so I'm just going to pretend I am wearing gloves at this point. So I'm going to clamp this off one more time, disconnect it from the suction, and I'm going to draw up 30 cc's of the distilled water, and we're going to very nice and slowly. We don't want to use any real pressure here. We don't want to hurt anything. It may feel a little weird going down. Okay, very good. Okay, you did really well. Looks like everything is flowing there. We're going to attach it back onto the suction. Okay, and then if there was anything in here, I would put some air into that tubing there to kind of get it back to flow in the suction. Okay, so now it's been several days. Keith, can you tell me your first and last name?
Keith White.
And your birthday, please.
1985.
Awesome. Month and day, please.
August 21st.
Very good. That matches with me. And do you have any allergies?
No.
No allergies. Very good. Okay, so we're going to discontinue this nasogastric tube. Yay!
Yay.
Okay, so I'm going to wash my hands. I'm going to put gloves on. I'm going to turn the suction off and detach this nasogastric tube. I'm going to attach the syringe to make sure that it's all kind of closed off if there's any fluids in there. Okay, so I do have gloves on. I've washed my hands. We're going to untape this here. Okay, and we're going to just go ahead and pull that right out nice and slow. Very good. I know that's a little uncomfortable. Okay, and I'm just going to check that tip, make sure it's still intact. Looks very good. And then I can just toss that into the receptacle as my facility states. Take my gloves off and wash my hands. How are you feeling?
Fine.
Very good. I'm going to give you the call light. If you do need anything, you give us a call. Otherwise, I'll be back to see you later.
Cool. Thank you.
Thank you.